We are also recommending for government to leave the education aspect out of political manipulations. We believe that the way information is given to us is skewed politically. That is what we believe, because everything was being guided by the information minister.
Are you trying to say you don't want the information ministry to be the ones giving us the information? I want to get that clear.
Please, the information minister is not an expert in health information delivery.
He doesn't, he brings in the experts.
No. He talks more than the expert, and they give chance to people who don't need to talk. What about the presidents and the vice presidents? And made political promises which were not in tandem with coronavirus. Whenever. The vice president yesterday, they should take it away from them. The health ministry has an information center, has specialists in public health who can give good information about health. We look at preparation of our health system. Our health system, if they had designed what we call a strategic plan, because they know it was a pandemic coming, definitely we would have known that we lack this and this and that and that at the early stage. We could have procured things, put in place to start. Remember, PPEs were procured for coronavirus, Ebola, that had now been used now. We could still buy those equipments. The PCR machines we have now being bought could be bought and put, even if the coronavirus doesn't come. We can still use them in our hospitals because they are needed. But government didn't prepare our hospitals. Training was not done until March. If they had isolated like China has done, with draconian isolations, the disease wouldn't have spread.
But why is this coming up now, considering the fact that we have moved on and some steps have been taken? Why are we going back to that issue now?
In brief terms, what we are saying is that though government has failed in many aspects previously, we want him to take a look back at what he has done. Sit down, get experts, let's draw a strategic plan. And the strategic plan should include massive injection of diagnostic equipment, testing and giving results within 24 hours, isolating people who are infected, quarantine them and be responsible for their quarantine and isolation. Then that way, we'll be able to nip the coronavirus in the bud. But this nature of taking samples, patient going home or staying somewhere until some number of days, tests come before he will go out and infest. We'll be pouring water into a basket. And that is what we have done so far.
But you are saying that government's capacity to handle the issue was not enough. Do you think that now it will be able to quarantine all those that they have tested?
Sure, we think there's a capacity. So far, coronavirus has given Ghana almost 7 billion Ghana cedis. How much have they used? They can't tell me. They can't tell us they have used half of it. If we do a new strategic plan and we have to look for more money and add and save ourselves spending more billions, it's better we do it.